and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, the season has arrived when common winter illnesses create a lot of problem for parents to keep their child away from diseases. So if you are concerned about the sickness this winter your child might face, it's important to know about the common viruses and illnesses. And to discuss on the common winter illnesses, we have with us in studio Dr. Mridu Plaban Borah, pediatrician from Excel Care Hospital. So not to waste any more time, I'll straight away move to him and talk more about the common winter illnesses that is prevalent these days. All right, doctor, welcome to Good Life, the health show. So you are here to guide us in the entire episode about the common diseases as winter is approaching. So parents has to be more careful about their children, that how to take care of their children. So first of all, we'll start up with what are the common diseases which is being faced by children in winters.
Yeah. First of all, welcome everyone to this show actually. To start with the common illnesses in the winter, actually, we must think of every parents actually, we are more cautious about their children. Number one point is cough and cold actually. It's very, very, very much common. And second common thing what I can like to just elaborate is the diarrhea. Okay. And other things, if you just see from above down actually, and respiratory infections are more common than diarrheas. And those who are allergic actually, in this change of seasons actually, we can have lot of exacerbation of all those allergic symptoms. If somebody is allergic in the eyes actually, they can develop in this change of season. If they are allergic in the, what I would like to mean is that if someone is allergic rhinitis is there, then they have the chances of exacerbating their symptoms. And the other thing is if somebody has got dry skin also, so in these seasons actually they can have more symptoms in this
so
skin.
dry skin have more and more symptoms.
In this season because the weather is dry. So if they do not take care of their skin properly, probably their symptoms of what we commonly call as atopic dermatitis actually. So in these symptoms may be aggravated during these winter seasons. These are basically not only for the children. This also holds for everyone actually.
Because when winter approaches, there are lots of diseases, and especially the cough and cold. It is very common seen in every person out there. And children are most common because like parents have to take more care of them and they doesn't take care of themselves, isn't it? So when it comes to children, so we have to be more cautious, isn't it, doctor? Okay, add more on that.
Yeah, actually to elaborate one by one actually, if you just come to the diarrhea part actually. So most of the things actually in the first day of diarrhea actually we definitely get a call from many parts of the of this region actually. So my child is having loose motions. What I would like to take the message actually to all my audience actually today is this diarrhea is actually it's not too much serious disease nowadays actually. Because if you see everywhere actually in newspapers, in TV discussions or any magazines actually, there are a lot of discussions in the common diseases actually. The thing is that if somebody develops diarrhea actually, what our prime work is that we have to maintain the hydration properly. So maintain hydration properly is that we have to give frequent liquids. Liquids in the sense actually we should better give ORS. ORS means oral rehydration solutions. But some of the products in the market actually they misguide us. There are some products which is known as ORS something actually, which is actually detrimental to the children.
Is it?
Because some products probably everybody comes to when I uttered this ORS probably everybody knows what is those products actually. I should not utter their names properly. But these are not suitable for the children. What is actually given is the WHO ORS formulas. This is also comes in various names. So we should mix it properly. Number one point is that one small sachet we should mix with 200 ml of water. And it should be given every 10-15 minutes, 1 spoon or 2 spoon like that. And for older children actually who are bigger children actually we can take larger packs and we can mix it with 1 ml of water, 1 liter of water, and we can give it every frequent hours. So if you give it like that way actually it will prevent the dehydration. In diarrhea, actually, this is the most common
Most important,
problem.
the body has to be hydrated
properly.
Okay.
If somebody is dehydrated, what the effect that will be going on into our body actually, number one, he can have headache. He may feel drowsiness.
Okay.
He will be lethargic. Lethargic means
So this
weakness.
is in general you are saying that if the body is dehydrated, that these are the symptoms.
Symptoms we can have. Their urine output can go down actually. That is the most detrimental point actually for a children who is not passing urine properly during diarrhea. We should be more careful of is their child passing urine properly or not. Okay.
That has to be taken care of.
If we give proper oral rehydration solution, probably we can make them hydrated properly and the child will be facing no problem at all.
Okay.
Other thing is that in diarrheas actually, what we call winter diarrheas, they can have some mild degree of fever, they can have some vomiting tendency. These are all symptomatic. Actually, it's a part of the disease, what we can say. And actually the thing is that if the diarrhea is associated with blood and mucus in the stool actually, so this is a critical condition.
Okay.
In those situations, definitely one should approach the doctor. And one point I would like to mention is that in the phase of diarrhea, if somebody is not taking properly, then definitely we should give more small frequent amount. Because they are not taking orally, they may be weak. At the course of time actually, they should be offered small frequent feed. So most of the time actually, parents actually they call us, no sir, no, my baby is not at all taking anything. So
because they are not willing to take anything at that point in time.
Any sickness can cause a decreased amount of food intake. So in those situations, we should give small frequent amount. And secondly, what is the prime thing? And the other thing, what I have already mentioned, so if there is some blood or mucus in the stool, this should be approached to
a doctor. Okay. So that time you have to be more concerned and you should see any time to a doctor, and furthermore on medicines will be given.
Most of the time actually parents comes to us on the day one of diarrhea. Today diarrhea has set since they come to us. But it should be remembered actually that usually this kind of winter diarrhea or viral diarrhea actually, they usually last for 5 to 7 days.
Okay.
So we should be we should have patience actually.
We should have patience because it will take his time, like the viral fevers, it takes their own time.
And in the same way actually, if we rehydrate them properly, probably we can prevent 70% of hospital admissions. And if we can rehydrate properly, probably we can decrease 30% of the death during diarrhea.
Such a wonderful words you have mentioned, doctor, because these are the less words we hear from any of the doctors, because you have said that first of all you should not panic and you should have patience. And if you find like there are some major symptoms being seen, then only you come and see a doctor. But day one coming, it's a concern of a parent for her children or for his children. But definitely one can also cure and one can also start the immediate and the initial stage precautions at home itself, isn't it, doctor? And hydration is first and primary thing to be done to any of the patient who is suffering from diarrhea, which the topic you have taken just now, and these are the common diseases, and these patients are coming frequently to you these days, isn't it? So this is happening actually.
Yes, it's diarrhea is going on, and regarding the cough and cold actually, what like to, and Diwali has just gone. Okay, now to be very frank, the air is totally polluted. And there is change of weather also, because I have already mentioned that during the change of weathers actually from summer to winter and winter to summer, in this critical juncture actually, everybody can have a normal cough and cold pressure. But amongst that, most important is the asthmatics. Those who are on treatment for asthma or who have likely to develop asthmatic symptoms during change of seasons, they should be more careful. Because somebody can have some milder symptoms, somebody can have severe to severe symptoms actually, those who need immediate medical care. So for cough and cold also, what I would like to suggest that is also important is that we have to make them hydration properly. So, because if they are dehydrated, they will not be able to take properly. Oral intake will go down, and if they are hydrated properly, actually they will not feel too much dizzy. That is important thing. And cough and cold also, what is like that, if somebody develops exacerbations of who are already asthmatic on treatment, or they can have developed exacerbation symptoms. Exacerbation means they had no symptoms, but with the change of season,
things are coming up.
Their respiratory symptoms may be more prominent. So okay, they should take immediate medical care.
Okay, okay.
So, but few of the things actually, some can have seasonal cough and cold. In the whole year they are okay, but during the change of season they develop symptoms, and they will be okay. This will be also like diarrhea. It will be only 5-7 days, and they will be better after that period. But if they develop severe symptoms, they should take medical attentions. Okay. In other things, what I would like to suggest regarding the what is called skin problems actually.
Skin problems, huh?
As
you have already mentioned, when dry skin appears, like diseases also appear frequently. Okay.
They should take proper care. They should cover up their whole skin, and they should use proper moisturizing agents. Then they should take vegetables and fruits.
And this is applicable for females as well, but also for the males as well.
Everyone. Okay. People are more concerned about their skins actually. This is for everybody, and they should hydrate them properly. So
because this is the thing which is not seen nowadays, as it's winter starting and people are taking less fluid, so that has to be taken care of, that people has to take a lot of like fluid and body has to be hydrated properly, isn't it, doctor? Okay. And in between of my show, I would just like to tell our viewers once again that the phone lines are open and the numbers are flashed on your television screens. So we have taken up the topic common winter illnesses today, and doctor is here in our studio. So if you have any queries, please do call up and ask your questions, and he is here to answer all your queries. So coming back to you, doctor, again, we are having a word on diarrhea. We already had a word, and which is like talk of the town, and frequently patients are coming to you on that disease. And cough and cold is also one of the reasons which is happening during these period of time. And now you're talking about like skin diseases. If your skin is dry, then you have to keep yourselves properly moisturized, and also to take a lot of like fluid. So what are the other diseases commonly, and especially I want to ask you that if a child is ill, how will a parent come to know that her or his child is ill?
This is probably the most take-home message today, actually.
Because if we talk about infants, we can't come to know unless and until we thoroughly check the
This is more important. This is more important. Every time, whenever this child is sick, it's not like that you have to attend medical care, or it's not always serious. There are some minor things, because parents are always parents, because they are more concerned of their children. So most of the important thing is whether his activity is normal or it is going down.
Okay.
One fine child, he was okay till yesterday, and suddenly he is falling sick, and he is not at all moving. He is all the time he is sick. That means he is want to take his bed, or he want to keep in the mother's lap, or he is not taking enough of diet.
The activity can be seen something else.
Something else.
There
must be changes. Okay. Minor change is okay, but he is not at all moving. He is always into the mother's lap. That must be something else. Okay. The other thing is the eating behavior. Okay, eating behavior, even if the fever or if diarrhea or whatever, cough, whatever, everybody, whenever there is some sickness, there will be some amount of decreased oral intake. But if you find that no, baby is not at all taking oral feed, that must be a serious matter. Okay, then those situations actually, if we cannot give proper, feed, he might go into any serious conditions. Okay, that should be, we should be cautious about all these
doctor
things.
will on to that conversation, but we have a phone call, so let's take that phone call. Hello, who's calling?
मैं अनंत बोल रहा हूँ.
हाँ जी, बोलिए.
मेरा जो बेबी है 10 मंथ का.
7 months
का. हाँ, 10 month का.
10 months.
तो उसका अभी तक दांत नहीं निकला है. इसके लिए कुछ खिलाना, मेडिसिन खिलाना पड़ेगा क्या?
Sorry.
उनका दांत नहीं निकला.
ओके,
अच्छा. कुछ प्रॉब्लम है, कुछ और बोलना चाहेंगे बेबी के बारे में?
और वो खाने में एकदम मतलब मन ही नहीं है उनका, कुछ खाता ही नहीं है, उसको बहुत प्रेशराइज करना पड़ता है खाने के लिए. तो उनके लिए डॉक्टर के साथ कंसल्ट करना पड़ेगा, या इसके साथ ही ठीक हो जाएगा?
Thank you so much for calling.
Thank you. Yeah. आपका जो प्रॉब्लम है इसमें दो चीज़ है एक्चुअली. नंबर वन, जो दांत नहीं निकल रहा है उसके लिए घबराना नहीं है आपको, ठीक है. नंबर वन पॉइंट इज दैट वो आपको दांत निकलने का जो समय है उसको 6.5 मंथ से आपको 18 मंथ्स तक लग सकता है. ओके, सो यू कैन वेट. इट्स सम मोस्ट ऑफ द टाइम व्हाट हैपेंस, सो पेरेंट्स लोग हम लोग को पूछता है कि उसका दांत नहीं निकला तो सर उसको कैल्शियम दे दीजिए. सो ऐसा बात नहीं है. So he can wait.
Okay.
Definitely it will come.
So there
out.
is a time period.
This is a time period because it takes from 6.5 months to 18 months. Okay. Definitely it will take, come out. And second part is नहीं खाता है जो बोल रहा है. It's a very very common. कौन सा बच्चा नहीं खाता है? कोई नहीं खाता है actually.
So that's a very difficult
the
part
very
for a
difficult
parent.
part. It's actually what I mean. हम लोग को देखना है कि आपका बच्चा एज के हिसाब से उसका वेट ठीक है कि नहीं और हाइट ठीक है कि नहीं. अगर वेट एज के हिसाब से उसका वेट अचीव हो गया है तो इट्स ओके. सो in 9 months to 18 months actually this is the most critical phase of a child. So they are more active. They
If
are
like
more
the
playful.
weight and the height is okay, then
nothing
there is nothing to worry about.
Okay.
But if something is issues with that, then
Yeah,
at least
if the child is sick and he is not at all taking anything, then probably it's a major concern.
Okay.
If the child is playful, he is running around, and the second is that he is accepting orally because parents are always think that their child should be
very healthy,
chubby, and these are the healthy children. It's like a common notion is in our mind, but it's not like that. If the weight and height is okay, then nothing to be worried about.
Okay.
It's okay.
So coming back to our conversation again, doctor, we were having a
we were in the what are the critical symptoms? Okay, So we are talking about the feeding habit actually. Okay, if the child is not at all, if the child oral intake is going half than the normal amount, probably it's a major concern. We have to go to the doctors and we should consult. Okay. The other thing is what I have mentioned regarding the discussion with the diarrhea actually. If the baby is not passing urine properly, that is also one issue. In those situations, he should go to the. The other things is like that if there is mild grade fever, we can manage at home. Okay. Everybody has got paracetamol bottles in their home. Okay. When if the fever goes above 100 or more, then we should give paracetamol. But if you feel that no, paracetamol not at all responding, his fever is coming constantly, the fever is there, and the other thing is that fever is a bit high enough, means 103, 104, probably there must be something else.
Okay, doctor, we'll take a call and then we'll continue with our conversation. Hello, who's calling? Hello?
Hello.
Hello?
Hello. Okay, I'm calling from Karbi Anglong.
Yeah, sir.
My son is 6.5 years.
Okay.
And he doesn't want to take much food.
Much food?
And that's why I want to get some suggestion from doctor.
Is he facing any other problem as well?
Pardon?
Is your child facing any other problem or he is just not taking proper food?
He's not taking much proper food.
Okay.
Only he used to take little food. That's why his health became also thin.
Okay, can you please repeat his age once again?
Yeah, 6.5 years.
6.5 years.
Yeah, 6.5 years.
Okay.
It's okay.
He doesn't want to take much food.
Yeah.
Okay. Thank you so much for calling.
Yeah.
It's okay. This is another
6.5
problem. The
years.
same problem with the previous caller. Okay. 6.5 years not eating properly.
Everyone is concerned about the food habits.
It's a very common thing actually. Even in our chambers also, if you see, probably 50% of the patients they come with not eating well. Okay. Though the answer is same almost. You have to look for the weight of the age, for the age and height for the age.
That person also mentioned that he is not having that proper weight.
Okay. Then there must be some problem. Okay, he should better consult with a doctor. And other important point is that we can give small frequent amount.
Okay. Not in a bulk, but at least small frequent amount.
And every time we should give different diet actually.
Okay.
If you give same thing in the same bowl every time, the child will refuse it. Okay, he knows that something is coming with me with the same taste and all. So we can change the bowls or we can change the presentation.
Or some colorful bowls.
We can give in a different presentation. So, okay. And other important thing is that we can add ghee and butter. Okay, it will give more energy. And even if they take less of food, they will get more of energy. It will help in gaining weight.
Okay.
Okay, and the other
But the
thing is
quantity of that ghee and butter should be taken care of, isn't
they
it?
can, because if the adult people take a lot of ghee and butter, they will gain fat. Okay, but if a child they take more of ghee or butter, actually it will help in their growth.
Okay.
It will not harm their body, because
Okay,
their
okay.
energy requirement is more.
That's a
if
very
you
clear-cut message
Yeah.
for the parents out there, because that is the notion every have a confusion in
Yeah,
their
yeah,
mind, isn't
yeah.
it? Okay.
So that should be given small frequent amount, add ghee or butter, and give different item and different intervals. Okay, and most likely most of the situation these tricks actually works better.
Actually, these are the tricks. I hope the children are not watching our show. Maybe if they come to know about the trick, then the parents will have the difficulty in feeding their...
Parents should know, not the
Okay.
children actually.
Okay.
Parents should know the tricks, and they will definitely be
Okay, so we were talking about the symptoms, like how a parent will come to know
Yeah,
that
yeah.
their child is sick.
So, first I told about the activities. Second
Activity.
is the urine output, then fooding habits. Okay. Third is also the fever. If there is high grade fever, probably they should approach. Okay.
Okay.
Other symptoms, sometimes what happens is that with most of the time, actually with fever we see is the febrile convulsion. With fever, actually children between 6 months to 6 years, with fever sometimes they uprolls their eyes, their limbs become stiff. Okay. Most of the times actually it happens in the family. With
Okay.
what we call is febrile convulsion. It is also not a serious matter. It's not serious matter to Freud. Being a doctor, actually, I can say it's not a serious matter, but sometimes it causes a lot of panic in the families.
Yeah, of course,
actually.
because if they see their child in this kind of
Yeah.
position, then of course they will be
Yeah.
scared of it.
And in those situations, they should approach doctors. If we find that it's actually febrile seizure, nothing else, because if there is brain infection also, we can have those symptoms. If there is other things, what I would like to mention is that to just discuss with the common problem, actually it's easy, but with that common symptoms actually we can have some dreaded disease also, because
Okay.
like Japanese encephalitis, viral encephalitis, they can present like fever, they can present like simple febrile seizure, but with investigation and with examination actually we can detect something
Okay.
dreaded. Okay, that's why actually for those symptoms, these are most common things, they should approach doctors and they should get a consultation, and they should be confident enough, yes, my doctor is telling the good things. Most of the parents actually, we are very much difficult to convince actually. They go on questioning and questioning,
Yeah,
but
lots of
I don't know,
questions to be
I
asked.
should say it or not. But most of the time we find it easy, but parents make it more difficult. But
So
it's
at
not
that
like
point
that.
in time, what do you do, doctor, when parents
So we
ask you a
try
lot of
to-
questions?
I try to convince them more and more with my, but sometimes difficult, but ultimately they come to know, yes, okay, the doctor is right. Okay.
If they get all the treatment properly and
Yeah,
then they see
definitely.
that your
He
things
is
are working out,
improving,
the child is improving.
definitely they build up their
Okay,
confidence.
so we had a lot of like symptoms, knowing things about like a child, how a parent will come to know. So what about the treatment, how to treat, and what are the prevention a person has to take care of their children to prevent from all these kind of diseases and
Okay.
illnesses?
With discussion, actually, I'm already mentioned some parts of the treatment actually. So
One has to maintain, I think, the hygiene part also.
hygiene part is most
Very
important, because diarrheas they spread by hands actually. So when we handle our foods actually for the children, so we should wash our hands properly. Okay, through hands we just transmit a lot of diseases actually. Diarrhea can be prevented in those ways. So second thing, if somebody develops any cough and cold in the family actually, we should also wash our hand properly. And secondly, during sneezing and coughing, we can just prevent spreading the
That
droplets.
should be taught to their children, that you should carry a handkerchief and put it in front of your mouth.
Because most of the children actually, they are okay, but somebody in the schools actually having a cough and cold and a fever, and other children can be get infected. Okay, so what I would like to suggest is that for small children actually, so in those period actually during cough and cold, fever, so we can just restrict them at home, so that other children should not get infected, because it's like contagious, one after another, everybody they suffers. But if you can restrict them, they will be recovered soon. Number one point, and they will not spread the infections
disease
to others.
as
Okay,
well.
so it is better to restrict them at home, make it proper, hydrated properly, give
Okay.
small frequent feed, they will recover fast. Otherwise, if you feel that no school will be amazed and send them schools and they will give it to others, and their children also will take more time to just recover from the
Doctor, we'll
illness.
talk on that. We'll take a phone call as well. Hello?
হেল্ল'
Yes.
মই কৈছোঁ বন্দনাই কৈছোঁ শিৱসাগৰৰ পৰা
হয়।
মোৰ বেবীটোৰ বয়স 4 বছৰ দ্য প্ৰব্লেম ইজ ডেট সি ৰেগুলাৰ দাঁত ব্ৰাছ কৰিব নোৱাৰে নোখোজে মানে
Okay.
খুব জোৰ কৰোঁ দাঁত ব্ৰাছ নকৰে চকলেট এনেকৈ নাখায় উইকলি 4টামান খোৱা হয় এইটোৰ কেনেকুৱা ধৰণৰ নেগেটিভ ইম্পেক্ট হ'ব পাৰে এবাৰ জানিব বিচাৰিছিলোঁ
ওকে আচলতে তেখেতক যদি আপোনাৰ কেঁচুৱাক যদি আমি হেবিট এটা ফৰ্ম কৰিবলৈ অভ্যাস কৰিব পাৰোঁ তেনেহ'লে আপুনি উপকৃত হ'ব প্ৰথম কথাটো হৈছে কি ব্ৰাছ কৰিবলৈ শিকোৱাৰ প্ৰচেছকেইটা এনেকুৱা আমি সৰু ল'ৰা ছোৱালীৰ প্ৰথম কথাটো হৈছে কি তেওঁলোকে সদায় ডাঙৰক অনুকৰণ কৰে তো আমি দেউতাকে কি কৰিছে মাকে কি কৰিছে সেইমতে সেইটোৱে এতিয়া ৰাতিপুৱা ব্ৰাছ কৰাৰ সময়ত যদি সি কথাবোৰ মন কৰিছে ডেফিনেটলি মই এইটো নাভাবোঁ যে সি এডাল ব্ৰাছ নুখুজিব ডেফিনেটলি তাৰ সন্মুখত যদি তাক ব্ৰাছ কৰে তেতিয়া সি ভাবে যে এই বস্তুটো কি মুখত লৈছে এনেকুৱা সেই ব্ৰাছ এডাল তাক দি দিয়াটো উচিত সেইখিনি সময়তে এনেকুৱা নহয় যে আমি ব্ৰাছ দিয়াৰ লগে লগে তাক পেষ্ট লগাই দিম তেনেকুৱা নহয় তো প্ৰথমে আমি তাক নৰ্মেল ব্ৰাছ এডাল দি পেলাই অভ্যাস কৰিবলৈ শিকিব লাগে ছেকেণ্ড পাৰ্টটো হৈছে কি সি মুখত পানী লৈ পেলাই পেলাব পৰা হৈছে নাই স্পিটিংটো অভ্যাসটো আহিব লাগিব তাৰপিছত আমি পেষ্ট দিম এতিয়া কথা হৈছে কি আমি সৰু ল'ৰা ছোৱালীক আমি গাখীৰ এটা খুব উত্তম খাদ্য বুলি আমি খুবেই দিওঁ তাতে যিটো মিঠা বস্তু থাকে দাঁতত যেতিয়া লেয়াৰ পৰিব তাৰ পৰা কেভিটিছ ফৰ্ম হয় আৰু কেভিটিছ ফৰ্ম হ'লে আমি ইনফেকশ্যন ইনভাইট কৰা নিচিনা হয় যে সেইটো ইনফেকশ্যন হ'ব আৰু তাৰপিছত লাহেকৈ তাৰ কোনোবা দিন ইনফেকশ্যন হ'ব হৈ পেলাই দাঁত বিষাব পৰা এনেকুৱা নিচিনা হৈ যায় আৰু এটা কথা হৈছে কি আমি ইনফেকশ্যন প্ৰিভেণ্ট কৰিবৰ কাৰণে বা ডিকেটো কম কৰিবৰ কাৰণে আমি পানী বেছিকৈ খুৱাব লাগে পানী খোৱালেও তাৰ যিটো চুইট হেৰি লেয়াৰ তো সেইটো নহ'ব আৰু খোৱাৰ পিছত কুলকুলি কৰাবলৈ শিকাব লাগে এইবিলাক কৰি আমি
So these are the basic habits that should be taught to their children, isn't it?
Okay, definitely.
And talking about the brush part, that also the parents has to be like cautious more, and that is to be taught in a very initial stage, isn't it, doctor?
Yeah.
Okay, so those things has to be taken care of. I'm sure the viewers who have just asked the question must have got your answer, and it's in initial stage you have to do all these good habits taught to your children, and I'm sure they will also follow you as well, isn't it? Being a parent, it has to be seen that your children follow you in all the good things whatever you are doing. On that note, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and I'll straight away move to Doctor and talk more about the talk which we have taken. Doctor, coming back to you again, we were earlier to the break, we were talking about the prevention on these common illnesses, which is prevalent in these winters. Okay. So you were talking about some of the healthy habits. So what are the other healthy habits we can teach the children, as hand washing is the primary thing we should teach the children, isn't it? Yeah. But somewhere or the other, we see that some children, they skip hand washing and they straight away come and have their food. So in that point in time, what will the disease attack them straightly, or what will happen?
Yeah, hand washing is not for the children actually, in the healthcare professions and in every spheres actually. Probably hand washing is the most important thing by which we can prevent transmission of illnesses. If a child do not wash their hands properly, actually, the first thing they are prone to gastrointestinal symptoms.
Okay.
They may have loose motion, they can have abdominal cramp, they can have vomiting actually. So these are the most common problems they will suffer from. Okay. So this is most important. So for developing these symptoms actually, we should start from the very beginning. So even in the school age actually, if you can teach them properly before taking their tiffins, or at home also if the parents washes their hands. What I would like to mention actually, this is my opportunity to pass this message actually. There is a term called democratic discipline. Okay, democratic discipline, because this is regarding the food habits and the other habits, health related habits, whatever. So okay, we always talk to the children, don't do this, wash your hands, okay, don't take junk foods, all these things. But the other adult family members, they take a lot of, burgers and all the unhealthy habits they develops. Okay, this is not actually.
Okay.
We should show their,
We have to set an example.
set an example actually by washing hand in front of them. That, yes, I am washing your hand. You also do it. Okay. In the table manners also, we should teach them. If we are just allowing them to take a lot of vegetables but we are taking a lot of chickens and muttons and whatever, so it will not. It will not give a proper message to the children also. So it should be democratic. Somebody is being obese actually, your children, and I'm trying to cutting down their calorie intake or whatever. When on the other hand, I'm in front of you, I'm taking a lot of unhealthy things or the unhealthy rules actually, but it will not give any message to the child. This is called democratic discipline.
Okay.
Washing hand also the same thing actually. We should teach them properly, then they will definitely inculcate their behavior.
If they see us washing hands frequently whenever we are out for our meal or whenever we start our meal, so then they'll follow us.
Definitely it will inculcate their behavior. Okay, so this is one. And secondly, to prevent the transmissible diseases like cough and cold, we should take handkerchiefs. Okay, we should wash our hands in those situations also. This is another important things. And regarding the food habits, okay, food habits actually, it's very lamenting part actually. If you just go by the way actually, every 50 meters you can see a wine shop, but you will not see a fruit shop or fruit juices shop. This is very much lamenting for our regions actually. So this is actually the stakeholders should take the yes. If somebody is giving some stalls of any fast food, it should be a mandatory things that you should keep fruits items in your stalls.
Fluid
items in your stalls. Then only you will be allowed to sell this junk food or whatever. So this should be a guidelines. Okay. Then probably we can develop the habit of
absolutely a very generous thought out of your mind.
So it should be because it's very pathetic. If you see anywhere actually every 50 meters there is wine shop. To be very frank, okay, it's not a good healthy scenario in our country. So that should be. And regarding that exercise habits and all to just make them healthy, actually there should be 20 minutes of minimum exercises daily, and at least 6 days a week. It should be develop in the family itself.
And nowadays what we have seen in children that they are always busy with the mobile phones of their parents. They play games or whatever they do in the mobile phones. And physical activity and the playfulness of the children is missing these days. So this is also a matter of grave concern, isn't it, Doctor?
Yeah, this is very bad.
So whenever a parent comes to you, so do you suggest them that you have to, like, as we don't have like parks and fields also nearby, because wherever we see there is a lot of big flats and big buildings out there, so we don't have a proper play area also for our children. But in that mode of time, what things can be added to their playfulness things at home itself and not give them mobile phones to do? So what suggestions do you give to the parents?
Actually, yesterday also I was just discussing one child who is obese, number one, and secondly the child is hypertensive.
Hypertension?
At the age of 10, he is having blood pressure in the higher side.
Okay.
So I try to convince the parents actually, you see, you give lot of importance in his physical activities, okay. Then the father told me that yes, we are cutting down his calorie intake. Okay, now he is taking a lot of fruits and vegetables. Okay, that's fine. It is very much encouraging. But regarding physical activity, also it is very no sir. Nowadays the school time is very here. When he comes back, it is very too late. And again there is some homeworks. Again next day school say there, but it should not be actually. If I look at the parents also, they are also obese because obesity runs in family. So previously. If obesity in other terms, actually this is also malnutrition. Mal means bad. Okay. Previously we thought that somebody is not gaining weight, who is too much cachectic, who is not getting enough of milk like the beggars. We call them malnourished actually.
Malnourished.
Actually those who are too much obese, they are also termed as malnourished actually.
Isn't?
Yeah.
Okay.
This is the same thing. This is malnourished. These are not nourished in a proper way. They are malnourished actually. Obesity also a malnutrition in okay. And in India it is growing up Growing up in a immensely it is growing up. Number of children who are obese, who are diabetic, who are hypertensive is it's growing up. It's okay. Coming to the family actually particular, then I just trying to say the same thing actually. Like that you should develop a democratic discipline in your family, because I think you also need some physical activity, and you also regarding the mother actually you also need some physical activity. Sir, मैं तो कैसे जाऊँगा? That they are from a Hindi speaking family. कैसे जाऊँगा? बोलो you see, you need not have to go to the gym actually. So physical activity means nowadays the habit is we have to go to the gym. Okay,
that's not always
that's
correct.
always the things. We can walk. Walking is the best exercise from the age old time, and walking is the best as well. So what I would like to suggest those families actually who do not have enough of time to go out, they do not have enough of space to just walk out themselves, they can buy some play items at home, like a treadmill or whatever. So okay, every time, anytime in the day hours, whenever they are free, they can walk around at least for 20 minutes per day. It will definitely help.
And if it is not possible for some families, then at least they can walk around in their lane, and
yes, definitely,
just 10 times walking would be enough for them.
Enough. So physical activity nowadays, though it is very much difficult to advise to everyone, but it should be must. It should be in the part of the
because physical activity for parents as well is also very less, because in office also if you sit for hours and hours and you are doing your job, then also you don't find any physical activity and you are just munching on all the snacks, or you're munching on your food, and what happens is that obese. So that trend is being followed by your children as well. If he or she sees you in that mode of period, then they will follow as you.
Definitely.
And if you are setting an example for them, then you have to go with the flow, and you have to do as well the physical activities, and also keep a check on your diet as well.
Exactly.
Isn't it, doctor?
Exactly.
So is it difficult for the parents whenever they come to you and you tell them that you have to follow as well, then only you can set an example for your children? So do they agree with you? And as you have already said that how will I go, or some type of questions come up that I don't find time, or there is no space for my children to play. So they can, at least some activity can be played out in their home as well, isn't it? So, but strict no to mobile phones, because that poses us some information, but sometimes it has been seen that hours and hours children are stick to their mobile phones.
This is totally a bad habit actually. On mobile actually I should give some message actually. Mobile it's not at all helpful for the children. Okay. So even for us actually the useful hours for the mobiles is very less. We actually busy with some other things actually. It's not actually busy with the more important things. Even in the children actually we are just seeing in these days as autism is growing up.
Okay.
Autism, it's a very bad conditions for the children. It's most of the time we feel that it's very difficult actually. At 2.5 years, somebody comes to us actually, though our child is not developing speech.
Okay.
Speech development is delayed. He is not talking enough. Okay. So then what we see is, yes, he is not at all giving eye-to-eye contact. He is not following verbal commands. Somewhat he is hyperactive. Okay. And he's tried to be in his own world. Okay. This
so
kind of
the
behavior,
child is not expressive as well.
expressive as well. Okay, this is called autistic behaviors. Okay.
Okay.
This kind of behavior we are very much commonly getting in our day-to-day practice.
So in
Now
that
it's
point in
increasing.
time, what suggestions do you give the parents?
This is we first of all Jai usually said they stop mobile. The screen is very addictive, not for the children or even for the adults. So the screen is very addictive. Okay, so by looking at the screen actually they get overflushed. It gives some electric short circuit in our brain actually. Though the synapses, which is in the developing brains, so they do not develop properly.
Okay.
So it gives actually their brain do not get the enough training what should be in the proper way. So mobile is very much detrimental for the developing brain. So most of the time we see if an autistic child comes to us actually, most of the time we think that he is used to, he is hooked to the screen actually most of the time.
Okay. So you are getting those cases these days.
Very commonly.
Okay.
So mobile is not a healthy your play item for the children. We should try to avoid them. We should not give actually. We should develop there are a lot of things to develop in our inside the home also. We can teach them vegetables, we can teach them the play items, we can teach various household items. So
some study puzzles can be brought out and then you
okay. Because the parents actually probably we have got less time, we are giving less time for the children, and thereby probably the mother has to work some work, and what to do with the child. They give the mobile, he is busy with the mobile, or he is just putting on the TV and he is just busy with the whatever is coming out, but thereby we are not actually giving proper stimulation of the
and a proper timing of the parents to their children is very important these days. If the working parents are there and we see that children is being kept somewhere with someone's help, so those things also hamper their mind, isn't it, doctor? And children feel alone sometimes. Maybe they are habituated with the things what is going on with them, but sometimes they feel alone and they don't get the attention from the parents which they need from them. So at that point in time, what do you think that the children, those things also affect their mind, and it can also trend them to any kind of disease as well?
Yeah, autistic is like that actually. This is it. Their mind is not developing in a proper way. They are taking their different role. Even if you see that those who are not autistic, but they are more into the screen. Okay, they actually live in a different world.
Different world.
Different. They do not develop to say you hi, hello, how are you?
And in fact, the children adapt things so quickly that whatever they see in the television or whatever they see in the wherever video or visuals they see, they adapt those things, and the language also they speak out themselves.
This is different. Different. So they do not develop in a normal way. So this is how actually they have been impacted by too much of use of mobiles and
So what do you think that the school authorities, when they are in the schools, so are the responsibilities of the schools also to give them a guideline and to give them a guidance, and an awareness campaign should also be prevalent for the children out there that these things should be stopped or these things should be used less? So what do you think that school children and the school goers and the school authorities also should take up these matter and awareness campaigns? We have seen many of the awareness campaigns regarding the health system is also being taken up in many of the schools. So sometimes if any of the teachers or any of the professors or any of the principal come to you and seek for help, so what things would you help them out for their school? Like for the awareness, if they want to give it to their children and the parents.
Most of the schools are very much strict with the use of the screen and mobiles. Okay, most of I welcome them.
In fact, about the food habits as well.
Nowadays, what I am saying, I'm learning from my child actually. So what is important is school authorities are very good at all these things. But the rest of the time, what we being a parents, what we are doing, that is more important. Probably we can like messages actually. So every now and then, because it's very important, not only important what we say. Nowadays, it is a very well versed topic actually. Even in the TV shows, even in the newspapers, magazines, everywhere this is saying that yes, this is bad. But we being the adults, we the path breakers,
but how far we are applying it in our life?
It is more important. We should take it very seriously. Yes, this is not a very simple things, because it's not only damage their family, it will damage the whole society actually. So it's not like that schools are not taking responsibility. They are very strict in this matter, what I feel. So they can pass this message to the parents many more times actually, probably. So parents are a bit relaxed in this matter actually. We should be very careful.
So that was my another question for you, that how important is for the parents to take care and take extra care of their children. So what suggestions would you tell to the parents out there, that how you should take care of your children in any of the matter, rather using phones or like whenever they are going to school, if they see that if other children is facing some kind of problem, or if he or she is having cough and cold, so what precautions the children should take care. So what things they should teach their children.
They teach actually, first of all, if they are suffering from any common illnesses, okay, whether it is suffering from normal viral cough and cold or viral fever or any loose motions or normal sickness, whatever, we can restrict them for 1 or 2 days from going to schools. Okay. In those situations, we should give proper food at home, proper rest, okay, and also hydration properly. Okay, then probably we can help them to recover it quickly and thereby will stop transmitting the same illness to the other peer groups. Okay, this is one thing. And even at least some exams are there, child is prepared nicely, so he have to appear in the exam. Probably you can communicate with the teacher, okay, my children is this is going on. Probably they can sit for the exam, and after that probably they can communicate well and
they can find out a way for that examination thing.
Yeah. So this is other way around probably. The other thing is that if he's not at all able to go to school, probably the exam can be held in different way, so to help the children. Okay. So this is one thing what the parents should do. Actually, most of the time we see that yes sir, school mein sabka ho raha hai abhi. So this is not good actually. So
and regarding the diet reasons and what diet plans and what things, and you should not force your children to have a good amount of food. You can ask them to have a good amount, but we see that many parents force their children to have the food and they are not willing to have it. So what would be the reason, and what would you tell the parents that you should not force on your children?
Yeah, this is important. They are very children. They are actually what happens, they can take their decision at their own actually. If somebody is not hungry actually, they will definitely take food. Definitely. If somebody is sick, they will not definitely take food properly. If you feel that no, your child is doing well, everything is well enough, okay, so you can feel that you can take a consultation from the doctors actually, whether he is okay or not. If the doctors also said that yes, what I have already mentioned, weight is okay, height is okay, his activity is okay, his memory is okay, he's not suffering from any chronic illnesses, he's not suffering from any deficiency diseases. Probably whatever he is taking is okay. We should be satisfied from that. But we should take try to develop the habit of taking fluid and vegetables and the healthy foods, whatever.
Healthy foods.
So, okay, this should be, we should try to develop those behaviors.
And as winters are approaching, and if suppose the parents have to go out with their children somewhere, so proper wearing of clothes is also important.
This is also important.
This is very, because seasonal change and you might get the diseases very quickly. So what would you tell on that as well?
Yeah, sudden exposure to obnoxious environment, okay, that can,
because sometimes it's windy weather as well.
Yeah, it will impact the definitely, and if you feel that you are not, feeling that this might can happen, but you are going out unprepared actually. If you have to expose your child in a certain different kind of environment, their immunity doesn't get enough time to just fight with the disease actually. So winter is one of those things actually. In extreme cold or in an extreme change of weathers actually, our immune function doesn't work well. So we get infections very easily during the winters actually. We should cover up nicely, and accordingly we have to prepare. Whenever you just go out, whenever you go out,
we have to be
prepared first. We should know about the weather, we should know about the temperature, we should know about the anything.
Especially about the children, we have to take care of, because they get it like quickly.
Yeah. So that should we should have a prior thinking before going to expose our child to that certain environments. So that
has to be taken care of. So I'm sure the parents who are watching our show, you are listening to doctor that these are the things, these are the preventions, and these are some of the tips and symptoms whenever you find out from your children. So you should also move to any of the doctor if there is any kind of serious symptoms you find in your children, that your children is not having a proper kind of food, diet is not good. You should always go and see a doctor. But if you find that everything is fine and still your children is not having a proper food, that means he is filled with his tummy. So you don't have to take much tension on that, isn't it? And have patience, because I always ask any of the pediatrician who come to my show and tell the parents that you should not forcefully feed your children, because if they are okay and if they feel that they are done with the food, they will say I'm fine. But if they are not, maybe sometimes due to playfulness, and they want to go out for play and they want to finish up their food quickly, so they can tell their parents that I don't want to have more. These are also some kind of things, but sometimes you should also have patience, isn't it, doctor? So doctor, we are like about to end our show, but on last note, what would you like to tell the viewers and the parents especially out there? One last suggestion to them.
So what I like to say the parents is, do not panic in anything, okay? So now the healthcare system is improving a lot. Actually, we can approach any doctors to get a suggestions. One thing is that if you do panic actually, so things will go wrong, number one point. So whatever we have discussed today, actually, it will give a lot of information to you regarding the fever,
Yes.
regarding cough and cold, regarding diarrhea. Fever, give paracetamol. If not, go to doctor. If there is diarrhea, proper hydration is the most important
Very
things.
important.
Try to develop a healthy food habits. Okay. Develop your child to exercise or activities should be more, because children are always active, but they should be trained in a different manner. Okay. They should take the balance in everywhere. There should be balance in the study, balance in the food, balance in the games, and everywhere actually we should be taken care of. And regarding the common illnesses, do not feel that if your child is not going to school for 1 or 2 days, it will not hamper your study actually. Just keep them rest, give proper diet and fluid, he will recover fast. That is the most important thing. It's not every time, even with the 100, 200 fever, we need not have to force the child to go to school. It will definitely deteriorate his
Because
health.
proper
actually.
rest is also
Yes,
important
very much
with the
important for
medicines which we
recovery.
are giving.
Yeah. So this is most important. And other things regarding the mobile use, actually, probably we should cut down screen time. This is more important. We should interact more. We should give more time, because it is rather very much important giving time to children rather than giving a gadget to the children.
Maybe they can sit with their children, they can ask about whatever had happened in the day affairs and what happened in schools, talk about their friends, what happened with your teachers, what have they taught you. So these things can be discussed and something can be like done with it, isn't it?
Definitely. And other things, if you cannot go out for just improve your physical activity, or you do not enough time to just make out your time to go for physical, keep something at your home. Keep something at your home so that you can involve yourself in any moment of time. Not for the children, it's for everyone.
Okay. Okay, thank you so much, Doctor, for coming to our show, and it was like privilege to have you in our show and giving us lots of information. We are short of time. I'm sure you also have so many things to talk about, and there are lots of topic to talk about, but it's a very vast topic, and I'm sure the viewers who have just watched our show, it's the common winter illnesses. Winters are approaching, and the common winter illnesses is prevalent these days, and many of the patients also arrive to doctors and ask about what are these illnesses, and if they are suffering from that, proper consultation, proper guidance is also important, and a proper check on your physical activities and a diet is very important to have a healthy and a happy life. On that note, we'll have to wrap up the show of Good Life, the health show, but we hope that we will able to answer all your queries in the best possible way. And in our next episode, we will be trying to use some other important diseases and talk about that. So do catch us on next Wednesday at 4 p.m. live. Till then, keep watching Northeast Live. Thank you.